Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. So wonderful
Good
world.
morning. Good morning.
Good morning. The best show is when we're not on the mic.
Yes.
So, Dr. Mencia, this is Saturday.
I was talking about my chef creativity.
Oh, yeah. You are very creative, right? Well, you've always been creative. But there's a saying about your eyes are the, let's see,
You remember,
eyes of, what is it to the world?
the window.
The window of the world. But
Yeah.
but eyes are very important, and we
And
don't
the
think
window
much
to
about
the
them.
soul.
Oh, window to the soul. That's
Yeah.
what it is. Exactly.
That's what it is.
Yes.
Exactly. And we don't really talk very much about eyes.
About
and,
the eyes.
but-
Well, you remember one time we were talking, first we want to welcome Namdoon to the program.
That's it. Namdu, right.
Can she get the mic a little bit?
Namdu.
Good morning.
Good morning. She's
morning.
really here.
And she's a student from Nova University. She's a third year medical student. And how's your program going so far?
It's going like a third-year program. As well.
Exactly. And how's your rotation with geriatric medicine? Tell me a little bit your experience.
Oh,
Just the good part, please.
It's been all good.
Good.
I'm really happy that I got this rotation. I've been learning a lot, and Dr. Pham and Dr. Mencia are great preceptors. I couldn't have asked for better.
Good. Excellent.
Do they make you nervous? She's shaking. This is
Shaking
not
it.
television.
Yeah.
She's shaking her head. Right? She's shaking her head. Well, Dr. Mencia is a very good trainer, isn't he?
Yes.
We all feel that way. He's
100%.
trained me about the radio. I mean,
Well, yes, the radio, the wonderful well awareness is all about education. So we are happy you are here with us. And,
Thank you.
And maybe you can help us educate the public on eye disease and eye conditions. And, the thing that I always strive for is prevention. I'm very proud of myself when I'm able to prevent things from happening.
well, but talking
So
about
we were
the
talking
eyes.
once we were talking about the eye and aging. We're talking about aging and the eyes. And we were saying, the skin can wrinkle when we don't take care of the skin. But the hair can fall off. But the eyes don't wrinkle. The eye doesn't change. Remember we were talking about that?
That's
You say,
true.
you say, I never thought of that.
That's
You know,
right.
your eyes, let me tell you, my grandfather lived to 109, and that's why I became a geriatrician. And I used to look at grandma and grandpa, you look into their eyes, and they always look young. So a lot of time we tend to overlook, when we look at those cases of elderly abuse and elderly neglect, we don't look at their eyes. We look at the wrinkled skin, and we look at the all bent over back, and then we feel that they are less than human, and we abuse them. But when we look into their eyes, everything changes. And I tell you, I remember once I had a homeless patient. His name was Andy. And Andy will he was asthmatic, so he will come to the practice every month to get his prescription. And sometimes he was like James. Sometimes he would come like every other day because he had nothing to do. So he would come by the office and we'll see if we have food, we will give him food or water. And, we became friends with him. So I remember one of my office is very like state-of-the-art, clean. I keep it clean. I go outside. I make sure the parking lot is clean.
I know I'm moving in there one day.
Anytime you want to. And one of my nurses, she was from Armenia. One of my nurses, beautiful, tall lady, she said, Dr. Mencia, such a beautiful practice. Why do you have to take care of this guy? He come all dirty. And he doesn't look right. And he come here, he walks here with his bag. So I say, you know what? So she's Orthodox. So I say, so you believe in God? She goes, yes, of course. I say, good. I want you to walk back in there and look into his eyes. I want you to talk to him, asking how he's feeling, does he need medication? But I want you to look into his eyes. Don't look at the dirty clothes. Don't let the smell touch you. Look into his eyes. So we went back in there and we started talking. And she said, wow, amazing what I have learned today. She said, I will carry this for the rest of my life.
That's brilliant. Absolutely brilliant. And it's what happens in nursing homes. So often people do look at the people sitting in a wheelchair. They see them hunched over. They may be drooling, but they don't look in their eyes. In fact, you'll see people, actually these elder people are so used to no one looking at them, they have their head down. They don't even put their head up for you to look.
And a lot of times, when you have people that have had strokes and what have you, we know so little in medicine. We know so little about the neurological component of the human body and the psyche. We still, despite what Sigmund Freud have done and Andrew Young and all these great master of psychiatrists have accomplished, Eric Harrison, excellent psychologist. They have provided so much, but in reality, we know so little about our psyche and our neurological component. And I give you an example. When you look at the anatomy of the eye, you have the your eyeball, and then you have a fluid that basically bath the lens and everything. And then at the end or toward the back, you have like a parabola. And that parabola, she's going to take a picture of me now and make me smile. So I hope you guys can see me smiling on the other side of the room.
Oh, it's beautiful. That's beautiful. Oh, yeah, that's you. That's great. So the fluid.
Then you have the optic nerve. So that's a nerve, just like you have so many nerves that go to the brain in different directions. You have the vagal nerve that comes from all over the intestine and the heart and the lung and travel all the way, long nerve like this. But the optic nerve is just go right from the eye and go straight back. And then it fans out and go into the back portion of your head. And you can have a person that seems to be out of touch with the external world. For example, a person in a coma. And I usually tell the caregiver and the loved one, talk to the person. Because we really don't know, what the ears are perceiving and what communication is going on. And if you notice, a lot of times when police officers, when their partner get hurt, they will say, like, look at me, hang in there, look at me. Because the moment you close your eyes, you gave up. You gave up, you finished. And when you are running a race, you don't look at the audience. If you are the winning person and there is somebody threatening you with taking the win away from you, you look ahead of you. And you keep your eyes focused in front of you. So the eyes are more important. It's not just only to look and appreciate the beauty that nature is giving us. It's really a form of, it's the middleman between the internal and the external world.
That's well said. So knowing that, is that why you brought an ophthalmologist into your practice?
Well, what I did when I created the center, when I came up with the idea of creating the center, that the idea is not mine, really. It's my patient's idea. When I created the center, it's my patient that told me, Dr. Mencia, if you cannot take care of the skin lesion I have, I'm not going to go to a dermatologist. I'm too old for that. Oh, but we had to cut the nails. Oh, no. If you can not cut my nail, I'm not going to a podiatrist. You forget it. Leave it the way they are. And I see people nail just bending and going back into the skin and penetrating and creating ulcers into the skin. And I couldn't take it. So I started cutting people nail when I opened my practice by myself. I will cut people nail. I do a lot of dermatologic workup. I will treat the eyes, a lot of conjunctivitis and pink eye and what have you, whatever will come in. Patients that were taking drops for glaucoma will make sure their prescription gets refilled. And I say, yeah, but if I want to provide better service, I need to get a podiatrist that know what they are doing. They know better than me how to take care of that. and I need an eye doctor. So I started basically starting with the most frequent use, so specialty. So the dermatologist. Today we're going to have the podiatrist at the office. Every Wednesday we have the eye doctor that sees patient, and we do surgery. We do cataract, we do the eyelid. I think next week, we're having 2 eyelid surgery. So that's for aesthetic thing. But we do the surgery. Sometimes the eyelid surgery is not aesthetic; it's necessary because the eyelid. The eyelid, I have my Asian eyelid, but the eyelid can grow so much that can block your vision.
Yes.
And you need to have the...
Isn't it called blephitis or something? It's a BL. There's a certain thing, with the eyes go down. You have to go to a certain kind of person.
Lazy eye.
It's a lazy eye, right?
Eye.
It's very special. And you're right, people can't see, so it's not done for cosmetic purposes.
So if you're going to have it done through your insurance, you have to go like this to your doctor. Doctor, I can see. I need surgery. Can you please help me? Not today. Okay.
So you decided that you
so
need
the
to have someone there.
Absolutely. And then being a geriatrician, we do basically the similar workup in a patient as a neurologist. So we do all the workup as a neurologist. And I was going to go into neurosurgeon. So I got very involved with neurology during my initial training. But I felt that a neurologist will be good to have because that way we are building up toward the future a memory center. Because memory center, you need the neurologist, the neuropsychologist, and the geriatrician.
No, you have always been very far thinking. But my question to you was,
and then the teeth.
Oh, of course, the teeth, that was natural because Rosemary was the dentist, and it was a natural thing to have
the founding mother.
The founding mother.
The teeth. When a person dies, right, and the body disintegrates, the teeth will be there.
Because the mummies have
right,
the teeth.
The teeth.
They do.
The teeth are meant to last over 3,000 years.
Wow.
Over 3,000 years. So shame on all of us who are losing teeth, because that means we are not taking care of ourselves. So, when we don't go for our cleaning, we don't take care of the supporting tissues that hold your teeth in place. Teeth is very important. So having a dental department in the medical center is out of this world.
And no one has that. But
no one had that. I have a patient that was going to go for implant, and she goes like, and she was going to go to another center because it was cheaper. And she said, I wish you were there with me because I'm so scared. I said, why don't you have it done here? Because it's cheaper.
It's probably,
I say, okay, what about if I match your price? Whatever you're getting, but at least you're going to get me.
Wow.
And she goes, you will match that price? And she was getting,
that was great.
Yeah, from one of the teaching institutions. She was going to get a procedure. And I said, we'll match the price for you.
And it probably wouldn't have been as good.
Yeah.
But that's what they were like. But wait, I'm going to go back to something that you said. So I've always been under the impression that you just go once a year, your vision checked, for your hearing check. But you're saying that your particular practice, that people can go every 6 months to have their eyes checked.
Every 6 or quarterly, because it's all about prevention. When we look at glaucoma, it's more common in geriatric patients. As we age, we get what we call nearsightedness. And nearsighted people, objects that are far away, they start looking blurry. And they neglect that. Where farsightedness is, it is easy for them to see the things that are far away from them. So those farsighted people are the ones that take the book and they go like this so they can read what's there. Oh my God!
Their arms never get wide enough.
I have to tell you, I just turned 30, but the letter looks better.
Yeah, wow, you just turned 30, right? Well, but I'm going to tell you something you don't know.
Tell me.
Yes, that I have second sight. You know what that is? You probably don't.
No, talking about sight.
No, I can. You give me the tiniest thing. I don't have anything. No glasses, nothing. I'm 78 years old. And I can look at the tiniest little thing, anything you want to find. Of course, I could read anything. I was like that when I was 45. I started, I needed glasses, those heavier, those what you buy in the drugstore. And then that's how I was living. And all of a sudden, I could start seeing other things. And now I haven't had anything for 20 years. And 5% of the population has this. Second sight is something to do when the cataract is starting.
Or when they mature. Yes,
whatever happens, and then it opens up, and my mother had it. It's hereditary. My mother had it till she was in her 90s. So I'm very fortunate about that. See, I never can tell you something you don't know.
Wow, that's
it's called
interesting.
second sight.
I have a third eye.
Oh, yeah, the third eye. Third eye, yeah, you have a lot of eyes.
But cataract is nothing than protein inside the lens of the eye. So protein tend to deposit inside the lens, and they clump up together, okay? And they turn the lens from clear to cloudy. So when that mature, it becomes like a little magnet for you. So some people with mature cataract, it becomes like a magnet. And who is at risk of cataracts? If you go in the sun in a less COVID, if you go in the sun, you know how you use your sun blocker, right? When we go in the sun, we don't protect our eyes.
Well,
so when you get
sunglasses,
on the
you're
sun
supposed
with sunglasses that can protect from the UV lights. So when we go in the sun and we don't protect our eye, that will make the protein precipitate prematurely, and people can get cataract at a young age. So it's important to wear the eye protection. Diabetic patients are at risk, people with hypertension. Those steroid users, so people with, let's say, asthma or COPD, emphysema, that are on chronic steroid, they are at high risk of developing cataract. And people taking statin
drugs.
Statin drug for cholesterol, the cholesterol lowering medication. So if you are taking statin, when you see your cardiologist and when you get your information from the pharmacy, look at the side effect profile and see if it's one of those medications that can put you at risk of cataract. And when you go to the eye doctor, I had one of the patients that, thank God that we have medical record there, we have electronic medical record. So anybody that opened the chart can see what medication the patient is taking and what have you. But they have one of the patients say, I'm going to my eye doctor, and it's not in my center, it's outside the center. I say, well, do you have your list? It was her first appointment. Do you have your list of medication? She goes, oh, no, I'm going to the eye doctor. I don't need that. I say, no, you do.
That's right.
You do need that. So I printed the list of medication. I said, just take it with you. I'm sure your eye doctor see them.
Dr. Mencia, you brought up a very good point. Shouldn't everyone have a list of all their medications in their wallet, in their pocket? Because if they're going to the...
There is a show about that.
Okay.
We spoke about traveling, remember?
Yes, I remember
We spoke
that.
about traveling, and
remember.
we should always carry in our wallet
Yeah.
allergies. If you are allergic to anything, carry those things. A list of your medication, medication. And that cannot be a list that you made 5 years ago. It's a list that you update frequently. And you don't update by crossing things out. You have to redo your list. So it's crystal clear and no confusion.
Excellent. I'm glad you talked about that.
So in that list of medication, if you are traveling locally within the country, you just put the name of the drug, the amount that you are taking, how many milligram or how many ml or what have you, milliliters. Or if it's milligram or microgram, make sure you read the fine print. So something might say mg, something might say mcg. So you have to put specifically the concentration of the pill that you are taking, or the liquid that you are putting on your body, or the cream that you're using, what have you. How often are you doing it? And if possible, why you are doing it. Why you're taking certain medication. And I'll give you an example. Some people take antidepressant, but not because they are depressed, but because they can sleep. And they don't want to take any drug that is addicting. So if you end up in an emergency room and they see, antidepressant, so this person is also depressed. But if they read and you put insomnia, or sleeping problem. And when they read the list, they say, okay, so it's insomnia, it's not depression. So it's a lot of medication that have multiple use. It's not for not only for what they meant to be utilized. Sometimes we use it for other reasons. We use medication that are meant for epilepsy, but we use it for mood stabilizer, or we use it to control the neuropathy for the diabetic. So different medication that might have different use, you have to specify what you are using. Because if you're using something that is for epilepsy and you're in an emergency room, what are they going to think of you? Oh, this guy is epileptic. So they will follow the protocol for an epileptic patient.
Okay, so Ina, I have a job for you. I think it'd be great if you could write up a sheet and give it to your patients with all the things that Dr. Mencia and just said now. I mean, I would love that. And with his name on it, it could be a very valuable piece of paper where you have the name and then you have, the milligrams taken and why. And Namda, you're sitting here and you're listening. And as a new physician, wouldn't it be wonderful if you said that to your patients and said, you must carry this because my mentor, Dr. Mencia, said this. But Ina, I really see that piece of paper that all your patients get, and his name is on, the name of the organization is there.
We do
and
print that. We print it for the patient. We print the list
for
because
the
we are,
patient. You should do something.
And then what we do in our practice, because we have electronic medical record, every time we update we make changes, we print that and we give them, it's already printed for them. And it has all of the information that I'm mentioning plus more because my good friend Wendy, she's traveling to Europe. She's listening to us from Europe today. She went to Europe, and so we were saying traveling within the country. When you travel outside the country, and that means Canada, Mexico, or Australia, I don't care where you're going. When you travel outside the country, do not write the brand name. They don't want to know that you are taking Bistolic because Bistolic, let's say in another country, has a different name. You're taking a beta blocker. What is the generic name of that drug? And you write down the generic name. When you put the generic name of the drug, the person in Germany now can open that the computer and write down the generic name and say, oh, that medication here is so-and-so. Well, in the United States, it's Bistolic. If you're taking Wellbutrin, you write down the generic name. It's an antidepressant, but in other countries has different names. So many drugs has a name for this country, but when you go to other country, the name can change.
And how are they going to find that out?
When you get the prescription for the pharmacy, by law here, we'll give you the name of the drug and we'll give you the generic name of the
interesting.
drug. So when you write your list, if you're traveling outside the country, or if you want to, you can do both, like the list we print out for the patient has both names. So you have to have the generic name when you are going outside the country.
And I have to just say that people... You see, this happens, Londo. We have such an interesting show here. Dr. Mencia is like, you wind him up and everything just comes out. It's one thing to another. He's so marvelous at this. But we have to tell people who he is. This is the actor from Hollywood, Dr. Andy Mencia. And he happens to have a medical practice on the side.
Kicking us out.
Yeah, I know. And it's AGI Medical and Dental Center's Dr. Andy Mencia. He's going right now down to his medical office in Fort Lauderdale. The phone number there is 954-489-1345. Home visits are available, and they have just a highly trained specialists who work together to provide optimal cutting-edge patient care. We've talked about the dental department. They have an ophthalmologist. Of course, they have a big... they have, of course, the podiatrist we talked about, rheumatologist. Oh, the weight loss programs are extraordinary that you have your nutritionists. They have everything, neurologists. So everyone, just get this number. Remember, Pencil Talk Radio, write down 954-489-1345. And the website is agifl.com. So, Dr. Mencia, I know we're just, we have 1 minute. And you didn't cover all your notes.
No, we're gonna do an article on this.
Why don't we do the article on the ophthalmia? That's what we should do.
Because it talk about far sight, talk about astigmatism.
So many things.
It talk about diabetic retinopathies,
Yes.
very important to prevent.
Right. And look into everybody's eyes. And when you
Look
go to
into
Dr.
people's eyes.
Mencia's office, look into his eyes. He has the most piercing, beautiful brown eyes, dark brown eyes. And whatever's in those eyes, we can just see in your whole... He's so... Yes.
I see
Right. And of course, Ina has the most gorgeous blue-green eyes, and you have to, when you go there, you want to go and look at her. Ask for Ina, make sure. And then this is your first, sorry to
Your
use the
first
expression,
experience.
you're a virgin on the radio.
Yeah. No anymore.
You were a virgin on the radio. So Dr. Mencia, thank you for being here, and go down to your practice and make people feel good.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.